Do you ever feel like the world around you is spinning when you haven't drunk anything? Or maybe you've seen colors dancing on the wall when the lights were off. These might sound fun to some, but when they happen too much without taking drugs, you might want to pause and reflect. Now, imagine someone using drugs like LSD, magic mushrooms, or PCP on purpose to feel these things again and again. When this habit starts messing with their daily life, like missing work, arguing with family, or even hurting themselves, that's when it becomes a real problem called hallucinogen use disorder. It's not just about tripping, it's about losing control. Ask yourself, do you or someone you know keep using these substances even when it causes trouble? That's a red flag. What makes someone start using hallucinogens and not stop? Think of it like this. Imagine you're stuck in a tough situation, maybe stress from school, loneliness, or painful memories. One day, a friend says, "Try this pill. It'll make you feel like you're floating above all your problems." You try it, suddenly, the world looks magical, pain fades, it feels like escape. That's how it often starts, using hallucinogens to run away from emotional pain, stress, or trauma. Some people also use them out of curiosity or peer pressure. But your brain starts remembering that escape feeling. Over time, you might crave it again, even when you know it's risky. It's not just willpower, it's your mind looking for relief. Also, if someone in your family has struggled with addiction, you might be more likely to develop this too. It's a mix of life struggles, brain chemistry, and environment. How do you know if someone, or even you might have this disorder? Let's play detective. Imagine your friend Alex. Last month they were into music and hiking. Now they cancel plans, last-minute stare at the wall for hours, and say things like the trees are whispering secrets. Sounds strange, right? These could be signs. Other symptoms needing more of the drug to feel the same effect like needing 2 mushrooms instead of 1. Spending a lot of time getting or using the drug. Trying to quit but failing. Or still using even after a scary hallucination or panic attack. Some people might have flashbacks, suddenly seeing things that aren't there weeks or months later, even when they're not using. That's called HPPD, hallucinogen, persisting perception disorder. If you notice these patterns, it's not just weird behavior, it could be a sign of real struggle. So what happens when someone says, "I think I need help"? First, doctors don't use blood tests for this. Instead, they talk. They'll ask things like, how often do you use hallucinogens? Has it caused problems at work or home? Have you tried to stop? These questions follow official guidelines DSM-5 to check if it's really a disorder. There's no magic pill to cure it, but treatment focuses on therapy, especially counseling, that helps people understand why they use and how to cope without drugs. Cognitive behavioral therapy, CBT, is common imagine learning to replace the thought "I need to escape reality" with "I can face this with support." Support groups like Narcotics Anonymous also help. In severe cases, a short hospital stay might be needed if someone is deeply confused or unsafe. The goal isn't just to stop use, it's to build a life where you don't feel the need to escape. Can this be avoided before it starts? Absolutely. Think of it like wearing a seatbelt. You hope you won't crash, but you wear it just in case. Education is key. For example, in schools, when kids learn not just drugs are bad, but why, like how hallucinogens can trigger lasting mental issues even in healthy brains, they make smarter choices. Parents talking openly, not just scolding, helps too. Imagine a parent saying, "I know people try these to feel free, but it can trap you instead." That starts real conversations. Also, building strong mental health through hobbies, friendships, and stress management gives people better ways to cope. If someone's already experimenting, early help, like speaking to a counselor, can stop small use from becoming a big problem. Science is always moving. Recently, researchers are looking at hallucinogens in a new light, not as just dangerous drugs, but as possible healing tools when used safely. For example, Studies are testing tiny, controlled doses of psilocybin from magic mushrooms to help people with depression or PTSD. But here's the catch: this is done in clinics, with therapists not at home. It's like using fire to cook, not burn down a house. These advances don't mean drugs are safe to use recreationally. Instead, they show we're learning more about the brain. Also, new apps and online programs now help track mental health and substance use, giving people tools before problems grow. The future isn't about fear, it's about smart, science-backed help.